Kenya is a country in East Africa. It is a hub of economic activities in the region and is known for its diversity in culture, warm-hearted citizens, and beautiful sceneries. As from 2013, after the first general election under new constitutional order, 47 county governments were established and charged with duty and responsibility of promoting the interests and rights of minorities, marginalized groups and communities, promoting social and economic development, and provision of proximate, easily accessible services throughout the country. All across Kenya, county governments have developed and enacted laws to advance gender empowerment. They have organized women into groups to ease their access to credit facilities. For example, in Murang'a County, over $1.5 million have been disbursed to more than 30,000 women. In line with the provisions of the 30% rule on procurement, county governments have promptly awarded tenders to women, youth, and people living with disabilities. This has translated to an increase of 50% of companies owned by these groups all across the entire country. However, over-indebtedness may creep in due to the women borrowing heavily. There are opportunities for micro-insurance and partnerships which may safeguard against the world-renowned tragedies of over-indebtedness in the household level. Microcredit beneficiaries need to be cushioned through incubation centers and ongoing sensitization on microfinance. Counties have also invested in mega street lighting projects. These projects have allowed women to attend to the current economy early in the day and sell their wares in the markets late into the night due to improved security. Nights are abuzz with women who attend evening classes after official working hours. Reported sexual assault cases have also significantly declined. However, this has led to the disenfranchisement of the other gender, resulting in an increase in violence cases preferred against women. To curb this, some county governments have started the initiatives which target men in a bid to counter the violence cases and enlighten them more on how to swim with the wave of rapidly changing dynamics. On a balance of events, there is an increase in household income and opportunities for development. This calls for the design of interventions that target greater investment to increase income and spread opportunities to all. Before devolution, there are 1.7 million children enrolled in early childhood development centers, commonly referred to as ECD centers across the country. After devolution, the number of children is now at 2.5 million and counting. The increase of the ECDE facilities in counties has reduced the distance children travel to get basic education. Women, therefore, can afford a few extra hours to economic and social activities as opposed to walking the children long distance to school. These children also receive nutrition supplements, meals, and basic health services such as vaccinations and deworming. These are fortified education strategies which meet the country's constitutional requirements.
We have the early childhood education. It is under the county government. And again, when the county government came in, we did a baseline survey to see what is the status of early childhood education in our county.
We want to thank His Excellency, Mr. William Kafogo, because of giving us this porridge. Children have really improved intellectually because of the porridge. They perform better in class. The porridge has also made the enrollment of the school to go high, and children concentrate better in class.
County governments have education sponsorship initiatives that have seen boys and girls get admissions in secondary schools which they could not easily access before devolution. These are high-impact activities that need solid partnership to secure sustainability. Water reticulation is a devolved function. Counties have invested in the provision of safe and accessible water. The long distances previously covered in search of water are now a thing of the past. In the health sector, county governments have seen to it that women enjoy improved health facilities. For instance, Machakos County has an ultra-modern maternity hospital, which is one of the best in the country. Mandera County recorded its first cesarean section in 50 years. This was due to the establishment of a modernized theatre. Thus begs the question, what happened to the women in the years before who needed this specialized treatment? County government have not only ensured the increase of the health facilities, They have also increased the human resources required to handle the massive number of health service seekers. For instance, nurses have been increased from 9,816 to 15,000, with medical doctors now standing at 3,786. The county governments have also largely increased the expenditure for procurement of drugs by 40%. The number of people who are seeking health services in various county facilities have more than doubled. Dispensaries in various sub-counties across the country have grown by 1,925, which is a 21% increase. Fully functional health centers have been upscaled by 15%. As of the 2015 and 2016 financial year, the number of hospitals has increased, some being upgraded to level 5 and level 6 hospitals. This has seen a 12% increment, thus easing access to health services. However, sustainability of these new facilities is a huge challenge. There is a gap in sustaining the staffing capacity for these health services and subsequent maintenance of drugs and equipment. Some of the counties have been suffering from inadequate funding to execute and maintain these major and resource-intense projects. The Kenyan government has made good strides in establishing significant legislative and constitutional support mechanisms to devolve service provision to Kenyans. However, the Kenyan public at the local level has not moved in similar speed of empowerment. There is need for countrywide campaigns for civic education that will encourage public participation, and especially for special groups like women who have unique priorities. The Kenyan government recently launched guidelines for public participation. Women, therefore, need to agitate for inclusion in county-driven development programs. In a bid to curb gender-based violence cases in Kenya, some county governments have launched the Gender Violence Early Warning, Early Response toll-free hotlines to take advantage of the widespread mobile technological advancements in Kenya. These hotlines link reported gender-based threats to response mechanisms by the National Police Service and religious leaders. This has increased women's access to timely medical interventions, counseling, and mitigation efforts. However, civic education is needed to publicize the numbers and enlighten more women on these new opportunities. This is a story of 3 years of devolution. We thank the President of Kenya, His Excellency President Uhuru Muigai Kenyatta, and all governors who have led us through the challenging transition period as we plan for greater achievements. We seek partnerships that will help us get to the next level.